I'm here with Dr. Sung. Maybe just tell us a little about yourself and your practice.
Okay. My name is Wailani Sung. I am a veterinary behaviorist. That means I have a board certification in animal behavior. I'm a veterinarian. I've also done a behavior program and have my doctorate in animal behavior. It's a psychology degree. My practice treats primarily dogs and cats and other animals with behavioral issues. So not just lack of obedience, but things like aggressive behavior, anxiety, for cats not using a litter box, or aggression towards the owners or the other cat, rabbits not using the litter box, or aggression towards people in the family, birds for attention-seeking behavior, feather picking, aggression towards the owner, so a wide variety of behavior problems.
And what are your thoughts on PupPod?
I think PupPod is a super interesting toy concept, and I think it's a good tool, not just as a toy, but a tool to help keep our dogs mentally active and physically fit. I think that the varying levels are really interesting because it kind of helps you determine how smart your dog is. I think some dogs, just like people, learn at different rates. Some dogs get some concepts and some dogs don't. And I think it's really interesting to kind of have your dog play it and figure out, can they learn? Because you start off very simple levels, very simple for their dog, and then you have some associations they have to figure out, right? And then as they get more advanced, they kind of need to figure out. So it engages them mentally, physically, and it probably helps kind of determine their problem-solving abilities. So I think it's really interesting, and it's amazing to see my dogs do it. I figured one of my dogs that I thought was really smart was not as smart as I thought, and the other that I thought was kind of not as brilliant was actually really focused on the toy, and he did perform a lot better than I anticipated. So it's very interesting the insight it gives on our dogs and how they think and react to problems.
And are there behavioral problems that you run across with your clients that you think PupPod might help with?
Well, I think that PupPod can really help with providing them with a lot of mental stimulation and physical activity. So we have a lot of dogs just in veterinary medicine alone that overeat. They inhale their food. And if you look at the pet store, there's tons of products out there like slow bowls, different types of interactive feeders to kind of reduce the amount of time they take to eat. So with PupPods, they can actually physically work their brains and mentally work their brains and physically work and help slow down their eating, help increase their physical activity, and also give them something to do. And if your dog eats his food in like 2 seconds, right, and with PupPod it takes like 15 minutes or 20 minutes, then that dog spends a lot more time working on the food versus another 15-20 minutes, being worried or being preoccupied or being destructive. So I think it's really helpful for any pet with behavior issues.
And with puzzle toys, do you generally recommend puzzle toys, and how big of a part of your practices is that?
Oh, I recommend puzzle toys for everyone. I don't think dogs should be fed in bowls. I always recommend 2 or 3 puzzle toys every meal, so the dog spends 10 to 20 minutes working on toys, because then they're more mentally active. They think about things, and I think if you see your dog play with them, I think that a lot of dogs get really excited about it. So rather than inhaling their food and they're done, they spend 15-20 minutes really enjoying what they're doing.
That's great. That's great. Well, thanks a lot for
You're welcome.
sharing your thoughts. That's perfect.
Anytime.